Aquatic therapy is defined as the use of water and specifically designed activity by qualified personnel to aid in the restoration, extension, maintenance and quality of function for persons with acute, transient, or chronic disabilities, syndromes or diseases by the Aquatic Therapy and Rehabilitation Institute. Aquatic therapy will consist of individual sessions of the therapist with the child, and it may consist of sessions where the family members are involved. The sessions can also be conducted as group therapy with multiple children and their parents. A detailed assessment is duly undertaken before the session. Safety parameters for the therapy in each child is considered before starting the therapy. Building a rapport with the child on land before entering into the water is essential. The time duration for the aquatic program is predetermined. Ideally, an aquatic therapy program for AST is for about 2 to 6 months with a frequency of 1 to 3 times per week. Some of the benefits of aquatic therapy are improvement in posture, coordination, and body control, reduction in improved sensory issues, improvement in social skills and improvement in cognitive functions. Aquatic environment is safe and easy to maintain, however it also has an inherent risk of drowning and therefore the therapy must be undertaken by a trained and qualified professional. The resourcefulness of water allows for a large variety of goals that can be achieved with children on the spectrum. So this was all about aquatic therapy. Thanks for watching this video. If you enjoyed this video, please do not forget to like and subscribe to our channel. In this channel you will get information about various health-related topics. Wishing you good health in your life. Bye.